Hey, good day. Welcome to Straight Talk Medicine. My name's Dr. Christian Grouse. I'm here with Dr.
Stephen Daniels.
That was spontaneous. Oh, for one more episode of Straight Talk Medicine. Yeah, today we're talking about something basically very near and dear to both of us, joints. When I told Dr. Kinnard we were going to be talking about joints today, he got all excited. He ran out and rented Cheech and Chong's Up in Smoke, and I had to explain to him it was a different type of joint we were talking about today. What we're talking about are joints in the body, the movable joints, the non-movable joints, what makes up your body as a dynamic functional unit. Yeah, so I'm not sure what else, what can I say about joints that would...
So there you have it, folks. That's our show on joints for today.
Yeah.
Thanks for tuning in. That was the brief show on joints. Well, like Dr. Grouse said, there are a number of different types of joints in your body. You have joints that are hinge joints, like you would have a hinge on a door. You have like a ball and socket joint, which would be your femur going in at your hip. You'd also have the same arrangement with your humerus going into your shoulder. Those are ball and socket type joints. So also other joints that folks might not be aware of are joints that we would call like a symphysis. And that's like a cartilaginous joint, like between your two hip bones where your pubic symphysis is. You also have similar joints in the skull too, that when the skull is forming as one, you have these little sutures that are actually symphysis as well, and those end up fusing over time, but those are other types of joints. And believe it or not, even at an older age, once those are fused after the age of 22, you can still do some craniopathy and some work to get rid of headaches, different things like that for certain patients too. So that's just kind of a quick gloss over. We're going to go into a lot more here in a few minutes. So,
well, it's definitely what we work with. I mean, it's as I've often communicated with patients, what I do is I do no more than work with joints. And when you get down to the nitty-gritty, there's about 360 joints in the body. I mean, a little quick rundown I found.
Right, you found some really interesting facts
86
about
joints
the
in the
numbers.
skull, 6 joints in the throat, 66 joints in the thorax, and that's also including, these are both not only movable joints, but some of these synarthrosises, like Dr. Daniels was talking about. You have 76 joints in the spine. Now that's definitely germane to me. That's, I can't think of a more pertinent fact to kind of share with you. You have 32 joints each in your upper extremity, so 64 through your hands and arm, and then 31 each in your lower extremity. So there's no shortage of joints in the body. This really becomes kind of pertinent because that's what we work with, that's what we deal with, and more particularly we deal with what are called diarthrodial joints. That's about $130,000 worth of my education to show off right there.
That's right, showing off of what we know about the joints, which is, like you said, is very germane to what we do. I mean, we're manipulating and tractioning and doing all these different chiropractic techniques to these joints daily on patients to help get them out of pain, to relieve their symptoms and restore their function and their range of motion. And so that's, like Dr. Grouse said, that's why it's extremely important to have a show on joints so that lay public can kind of understand a little bit more where we are in our view of the joints that make up the body.
So, and a point that is something I often illustrate to patients, that these joints in your body, especially as we talk about these freely movable joints, they're all made the same. Whether you're talking about a knuckle, whether you're talking about your ankle, your knee, your jaw, or the joints in your spine, they all have the same composition, they all have the same layout, and interestingly enough, they all have the same physiological response when stressed or put under too much strain or when inflamed. It's the same trend in the body. So understanding what tissues are there, how these tissues get stressed, what can cause stress in these tissues. I mean, this is more so than I fell off the monkey bars or I got in a car wreck. These are the simpler things, the more inane things that go in our lives that we don't think about, that the body still undergoes stress. These tissues still have to put up with mechanical loading. That's really where it's a challenge to communicate this at times. We all want everything to snap back and be in the place and be like a set of Legos, but you have to take a step back, look and go, man, this is still just tissue, and tissue needs to heal, and joints are just tissue. And when you start to pick apart these joints, I mean, there are elements, and everyone focuses on the bones as being the key elements that make up a joint, and they are there, and they are structurally what we associate with a joint. But I mean, there's so many other levels and layers of tissues that need to be addressed also.
Right. When I talk to patients about stress on the joints, let's take the cervical spine for example. One analogy I like to use is that if someone has lost the natural kind of C-shaped cervical curve that you're supposed to have, you see this a lot with auto accident victims. Their neck will be straight on x-ray investigation. The bones will be stacked right on top of each other. And that also can happen over time with poor posture, repetitive motion disorders, things of that nature. So what I often tell them is that, if you think about putting a bowling ball, you could use an 8-pound, not a 16, on top of a broomstick. I mean, this is a crude analogy, but it really drives the point home. And you balance it with your hands, and you lean that ball out farther on the stick like this. For every inch forward that you go, anterior or forward, that puts about 10 more pounds of stress on the posterior capsules, the ligaments, the muscles, everything else. And that's crucial to understand, not only from a posture perspective, but from that whiplash perspective as well. I mean, we haven't even talked about the joint mechanics from whiplash. I think we're probably going to put together an entire show coming up soon on whiplash, because we could go a completely different area with that right now. But just to kind of make that point, yeah, that's kind of what I use to tell them what's happening with the back of the neck and the joints and the stressing and loading. And we're going to get into some other things. Dr. Grouse dug up some really, really good information about the stresses that are placed on the joints and alignment of the tissue as it heals. We're going to talk about some rehabilitation stuff too coming up too, why it's important to stick with that. And he's got some really cool facts on Teflon and ice versus your cartilage in your bones or in your joints on top of the bones, which you're probably going to find pretty interesting too.
Yeah. I did all that?
You did all that.
Oh my word.
Yeah,
I must have been amped up on coffee and Mountain Dew.
One of his favorite drinks is to mix coffee with like an amp drink or a Monster energy drink, something like that. It keeps him going at the clinics.
Well, yes, it is my Achilles heel. But you already touched on a couple things that leads to a very nice segue into the next chapter. You talked on these tissues, the posterior joint capsules, the ligaments, cartilage. These are all histologically what makes up a joint, what tissues are in a joint, how they differ, and all these tissues differ on a cellular basis. So it's not just one ubiquitous tissue. It's not this gelatinous ooze that just molds into whatever. These are specific tissues with specific demands that have specific cells. So yeah, we'll dive into that a little bit more next chapter.
Right, so stay tuned. We'll be back in a few minutes.
Now, thank you for tuning back in to Straight Talk Medicine. My name is Dr. Christian Grouse. I'm here with Dr. Steve Daniels, and we are just talking about joints. Just quickly to recap, joints everywhere in your body. Joints that not only move, but things that don't move, such as the joints between your ribs and your sternum, cartilaginous joints. One of the messages that we hope we're able to get across earlier is that the movable joints in your body, the diarthrodial joints, they're the same. They are made the same throughout your body, whether it be knuckles, shoulder, foot, or your spine. And that's really where we kind of want to dive into from there to bring it home here, is what are these tissues that make up these joints, to kind of give you an idea of what is the makeup. Understanding what makes them up helps to understand how there could be problems down the road, as some of these tissues can be pain generators with time. So we already know, usually the way I introduce this to patients as joints is, usually a joint is comprised of two bones coming together. And that's what everyone knows, that's what everyone visualizes, that's what they think of, but there's a lot more to it than that. So along the top of those bones, we have the articular cartilage. The articular cartilage is what allows the joint surfaces to be able to slide and move freely past one another. Anyone suffering from severe osteoarthritis already knows that it's that wearing away of that articular cartilage that is causing those really strong arthritic type symptoms. The auricular cartilage is gosh, if the bones are the chassis, then the auricular cartilage, it's
like the
shock
lubricant.
Absorber. Yeah, it's probably a better
hydraulic shock absorber.
Oh my word. Oh my word, you had their Mountain Dew and Amp coffee now all of a sudden in the break.
It's from working on my truck too.
Man has yet to be able to synthesize anything that produces as little friction as cartilage on cartilage. There's some quick stats. From what there is of auricular cartilage as it goes past one another, ice on ice produces more friction than cartilage on cartilage. Two pieces of Teflon rubbing on one another produce more friction than what goes on in a nice healthy joint as the joint surfaces rub past one another. So we have yet to be able to produce anything that is as efficient and reducing friction and increasing efficiency. So if you're thinking of wonder coating your knee with Teflon, yeah, you're still not cutting it. It's not even close to what you have naturally going on within your body.
Right. Don't go for the Teflon knee replacement surgery. I mean, because that's not going to happen. So
yeah, well,
so, yeah, you're right.
Last resort.
Right. You're right about the numbers. I mean, it was really amazing to see what a difference there is between the man-made synthesized products and well, ice isn't man-made, but like Teflon, comparing that to ice, and then comparing the synovial fluid and how slippery it really is. I mean, like you said, there's nothing man-made that we can copy or even use as a copy to create anything like that. And it's just, it does a really good job.
Well, that's probably the next best segue. You just mentioned synovial fluid.
Right.
Synovial fluid, now as you start to build this joint, if you can start to visualize two bones coming together with the ends now covered in this cartilage that's super smooth, you need a fluid in that joint. And that's what Dr. Daniels had mentioned, the synovial fluid. The synovial fluid is produced by a lining that comes around the joint. What contains a joint is a joint capsule. And we'll come and talk about that more in a moment. But things have to be encapsulated, or it's just everything would be free-flowing and would fall over like unsupported Tinker toys.
Yeah, absolutely.
But on the inside of this joint capsule, we have something called a synovial lining. Techie word, and the only thing I want you to take away from this is it produces a fluid called synovium.
Right. And it has high hyaluronic acid in it too. And you don't have to remember that, but that's an important treatment option also for some patients. We talked before the show about a lot of folks go in with severe DJD, osteoarthritis of the knees or joints, and to relieve the pain because it's to the point where it's bone on bone. They end up doing cortisone injections, and that's fine to relieve the pain, but as we all know, cortisone injections, you can only get so many over a certain amount of time because it's really not healthy for your body as it processes that medication to get it out of there.
So as that synovium decreases, that synovium acts as a natural lubricant. So not only do you have two smooth surfaces that are allowed to go over one another, now your body's making a natural lubricant. So once you start to have degradation in that cartilage, once you start to have degradation in that cell lining that makes this natural lubricant, I mean, you can very quickly start to see how the biomechanics break down. And yes, I've had some patients try these hyaluronic acid treatments and they get results. It's always an option.
Right.
But once you've worn away what's there, it doesn't come back. It's a one-way process of degeneration.
Absolutely. It's not a two-way street when it comes to that degenerative process for sure. Another point that Dr. Grouse dug up that I thought was really important to bring up too, and this is kind of techie, but it's not too bad, is during the movement, when that synovial fluid is moving, it actually is the joint and that whole process, it's able to mechanically squeeze out and weep as it needs to lubricate. So it's almost like you have self-lubricating joints. You don't have to put a Zerk fitting on your knee to pump in grease because it weeps it out as it needs it. And that's just fascinating how the human body is designed to do that. Obviously, we talked about the reduction of friction for the joints too. It also serves as a shock absorber too. And this is another fact that Dr. Grouse dug up that I thought it was really, really cool, is the fact that it becomes more viscous or thick if it's applied to a pressure or stress. But then, like as in a shear force, if you're going to have a shear force moving from this way to this way, this is shear. So if you have that kind of force going on within the joint, it's actually able, your body's actually able to adapt so quickly that it causes that fluid to become thicker, more viscous, like from watery to more of a pudding-like substance, but maybe not that thick. That's just an analogy. And then the opposite happens when you have more of a vertical axial loading from this way, you know, axial up and down, it actually is able to thin back out. So just another fascinating fact of how that all works and how important these joints are and what they do to protect us, protect our bones, our movement, and facilitate our movement that we really don't give a second thought about. So I just find that really fascinating. And coming up in the next segment, we're going to get into a little bit more about the joint capsule itself, a few more things that the joints do, and that fluid, it helps to bring nutrients in because, as we know, there's not a lot of vascularity, not a lot of blood flow to these joints. That's why soft tissue injuries take so long to heal and rehab, unlike muscle or regular skin. And it gets the, through osmosis, it gets the nutrients in, the wastes out, then we excrete those and get them out. So stay tuned, we'll be back with more on joints.
Welcome back to Straight Talk Medicine. I hope you're still awake. I hope that didn't get too over the top in details. Unfortunately, the devil is in the details. And well, like I said earlier in the show, we spent a lot of money to show off what we know for our details. We had been talking about joints again, especially now we've been moving on to the composition of what makes a joint, especially a movable joint. What tissues make that up? We talked about the two bones coming together. We talked about cartilage being on top of those surfaces of those joints that allow them to slide past one another. We've talked about